Food tie-in, spleen meridian. Let's discuss spleen 4, Gongsun, grandfather, grandson. Located on the medial surface of the foot in a depression, distal to the base of the first metatarsal bone at the dorsal plantar skin junction. First, locate spleen 3, and then slide the finger in a proximal direction along the first metatarsal until it reaches a notch just distal to the base. Spleen 4 is a Luo-Connecting or junction point, opening point of the Chong Mai, coupled point of Yin Wei Mai. Spleen 4 is a wonderful point for the spirit of Earth. Its connection with Chong Mai, and thus indirectly with pre and post heavenly Qi, gives a sense of continuity through the generations and the promise of a future. All the richness of Chong Mai and spleen Qi in the production of blood and Qi with responsibility for distribution and nutrition brings a sense of abundance and flourishing, of being able to prepare and nourish and look to the future with confidence and optimism. If a person is feeling sorry for herself, oppressed and overwhelmed, this point will bring strength and trust. Ancestor and descendant is yet another name for spleen 4, which implies a continuity of nourishment through generations from past and present to future. The spleen works for the continuity of our life through renewing our essences and chi. Essences help provide the necessary environment for the spirits. Spleen 4 is the Luo-Connecting junction point between the spleen and stomach, and so can be used in this harmony that involves both and to tonify both. Stomach and spleen are closer than any other yin-yang element pairing in the closeness of their roles. Spleen 4 can be used to keep the balance of earth yin and yang in harmonious exchange. Stomach can find it hard to stop and spleen hard to start. Spleen yin controls the lower half of the body. Stomach masters the upper half. Stomach and spleen command the descending and ascending of the qi, the free circulation of which keeps us receptive to the influences of heaven and earth and able to separate the pure and impure. They need to be in good relationship as the controllers of the storehouses and granaries. What they ingest from the outside becomes part of us, and through being continually renewed, we remain able to participate in life, to realize and shape the possibilities that life presents to us. Good functioning of the stomach and spleen enables us to experience the 5 tastes. The grandson in the name can refer to the offshoot or connecting vessel of the main grandfather channel. Spleen 4 can be used to clear retention of damp in the epigastrium, stasis of blood in the stomach, clear stomach heat, and counterflow stomach qi. Spleen 4 is the opening point on the Chong Mai or penetrating vessel. Chong Mai coalesces with stomach 30, so both stomach and spleen independently, as well as through the Luo junction point, have a connection with the root of anterior and posterior heaven. Chong Mai is the sea of the 12 meridians, as well as the sea of blood. Chong Mai passes through the 3 jiao, affecting the kidneys, uterus, heart, and stomach in particular, as well as the medial aspect of the leg, and it has both a richly nourishing aspect as well as a more yang penetrating aspect to its energy, which makes it suitable for dispersing stagnation. Chong Mai links pre and post heavenly qi, so this point can affect and tonify the qi of spleen, stomach, and kidney. It is a useful point when there is chronic tiredness and weakness with weak digestion and constitution, anxiety, and depression. Stops bleeding. Spleen 4 activates Chong Mai. Chong Mai enters the uterus and regulates menstruation. This ability, as well as the spleen function of holding the blood, stops excessive bleeding. In activating the Chong Mai, this point can affect the circulation in the meridians, as well as the small capillary-like vessels pertaining to the Chong Mai, which diffuse over the chest and abdomen. In addition, the spleen is in charge of holding the blood together that is in the vessels, and spleen controls the minute connecting channels through spleen 21. Useful when there is blood deficiency and stagnation in the uterus or lower jiao leading to painful and irregular periods. endometriosis, fibroids, abdominal masses, and pain or distension. Spleen 4 helps problems of circulation in the legs due to stagnation of qi and blood. The Yellow Emperor's family name was Gongsun. This has been taken either to indicate the importance of this point to the earth element, as the Yellow Emperor was to the earth phase of Chinese history, or to suggest that the Yellow Emperor discovered this point. Indications of spleen 4 nourishes the mind and spirit when oppressed, ground down, or weak. Chronic tiredness and weakness, painful and irregular periods, endometriosis, fibroids, abdominal masses, pain or distension, Raynaud's disease. Junction point, opening point of Chong Mai, coupled point of Inwei Mai. One of the most beautiful and powerful points in the body. Consider where a patient has long-standing lethargy and weakness, self-pity, has a weak digestion, is anxious or depressed. Helps in cases of excessive bleeding, especially for painful irregular periods. Spleen holds the blood together. Fibroids or swelling of the abdomen. This point's name, Gongsun, has the connotation of continuity through the generations and is the family name of the Yellow or Earth Emperor. It connects to Chong Mai and thus to pre and post heavenly qi. The meridian passes through the three jiao before entering the uterus, thereby regulating menstruation, helps circulation in the legs, and as the junction point, promotes balance and equilibrium within the earth element. Indications and potential combinations. Genitourinary problems, we combine spleen 4 with spleen 6, PC6, CV4, CV6, kidney 3, bladder 23, bladder 28. Digestive disorders, vomiting, barbarigmi, diarrhea, dysentery, abdominal bloating. We use spleen 4 together with spleen 6, stomach 36, CV12. For medial foot pain, we combine spleen 4 with spleen 3. Check for trigger points in the tibialis anterior, stomach 36, extensor hallucis longus, GB 37 and 38, flexor hallucis brevis, spleen 3, and adductor hallucis, kidney 2, the muscles. Evidence-based applications. Acupressure at GB4, 15, 20, bladder 23, 28, 32, heart 7, 9, stomach 36, spleen 4, 6, 12, CV2, 3, 6, kidney 3, and 5 may be a suitable alternative to oxybutinin in the treatment of enuresis. Acupuncture at CV12, stomach 36, PC6, spleen 4, bladder 20, and bladder 21 with either the adjunct points LI11, GB34, and liver 3, or CV6, CV4, and spleen 6 improve gastric emptying in a case series of patients with diabetic gastroparesis. Acupuncture at stomach 30, 36, spleen 4, 6, liver 3, kidney 3, LI4, and PC6, plus moxibustion at bladder 13, 22, 23, 52, CV3, 4, 5, 6, 19, lung 9, and LI14 significantly increase the percentage of normal sperm in patients with idiopathic oligoasthenoteratospermia, or the OAT syndrome. Spleen 4 and PC6 in combination appear to work synergistically in regulating cardiac and gastric functional activities in rats with experimentally induced acute myocardial ischemia by promoting recovery of normal electrical activity and through its influence on nitric oxide synthase activity in the myocardium, gastric antrum, and duodenum. Thank you for your attention.